it's Dr. Pat with Little Critters, and we have a beautiful leopard gecko here that's in for a surgical procedure because he has impacted and infected hemipenes. The hemipenes are reproductive organs. They'll often get impacted and then we'll see them start to swell up, and in this case he actually has a necrotic lesion, which is dead skin where the hemipene abscess was about to rupture. You can see that here where I'm gently trying to remove the dead tissue with a forceps, and you'll see once this tissue is removed, we have a very large opening under there, and that's exposing the hemipene sac and the hemipene. Beside this, we had pretty thick white caseous debris, which you can see being expressed from the wound now. Reptiles tend to make a really thick pus. It doesn't tend to drain like we see in dogs and cats, and so this has to be debrided or removed. And we have a little attachment left here with the necrotic tissue, so we're just trimming that away so all the edges or margins of the tissue are clean and healthy. Now that all the purulent debris or pus has been removed, we're flushing with a diluted chlorhexidine solution to make sure that we get any lingering amounts left in there, flush out all bacteria and infectious debris. The final step is to place one suture just to oppose the tissue, as this is a pretty large opening over this hemipene. So this will help it heal a little quicker and faster. The suture will be removed later. Cleaning and flushing was repeated on the opposite side, although the wound on the right side was much smaller and less significant. Hemipene impaction is common in male geckos. It can be associated with some retained shed, also lack of vitamin A, lack of humidity. All of these factors are very important to keep your gecko healthy.